Are you tired of hearing your practitioner say your labs look good, but you know and feel in your body that something is off? Maybe you've been on a wild goose chase where no practitioner, conventional or alternative, has been able to help. Or worse, maybe you've had temporary victories, only for the same set of symptoms or an entirely new set of symptoms to crop back up soon after. This has happened to me, this has happened to my clients, and this has happened to many people just like you. But today I'm giving you the 5 main problems with lab work in conventional and alternative healthcare based on 2 decades of my research, clinical and personal experiences. Problem number 1, general preliminary lab testing is inadequate. This might seem obvious at first. However, this doesn't mean we need to test tons of markers early on. This does mean that what is tested in certain categories is too limited to accurately understand health status and to point providers to further testing or steps. And even the follow-up testing is often too limited. This isn't always or only an insurance issue. This is often an issue of awareness. The lack of awareness results in missed and valuable opportunities to better assess health status. And the fact that some of these labs are relatively inexpensive makes their absence all the more tragic. Now, this is most always true in conventional healthcare. This may come as a surprise that this is also often true in alternative healthcare. Some of my other videos shed further light on these labs, but the key takeaway here is that it's really important to understand that labs have their limitations, and a good doctor or practitioner is well aware of those limitations and knows how to exploit strategically selected labs for the value that they can yield. Problem number 2, standard reference ranges are too broad and miss subclinical issues. Standard reference ranges generally detect disease once a person is actively unwell. Contrast that to functional reference ranges, which can detect both when a person is unwell and when disease progression is in earlier stages. And that can be effectively reversed or slowed with such detection. Simply put, standard reference ranges are based on sick people. Sing that from the rooftop. Standard reference ranges are based on sick people. Think about it. Aside from going in for checkups, which many people forego and forget about, who visits hospitals and doctors' offices? Who? Generally people who are in advanced and highly symptomatic stages of feeling unwell. Standard reference ranges are based on statistical models of health that use very unwell people as a baseline. If you fall slightly outside that range, you're considered healthy, even if you're experiencing symptoms. It's a very common story. You have one manifestation of that is when a patient tells a doctor that she or he doesn't feel well. The doctor looks at the labs, which look in range, and tells the patient that she or he is healthy. Lots of air quotes here, I know. Another route that this can go is that a patient may actually present as asymptomatic, no symptoms, right? Or that patient may have symptoms, but just doesn't notice them. The symptoms have become kind of like white noise. That's what I like to refer to it as. Or the patient regards the symptoms as normal and forgets about them. And the doctor tells the patient that his labs look, again, air quotes, healthy. But that patient may have something brewing under the surface that may emerge in a matter of months to a few years. And that may also make the patient more susceptible to other conditions. So those months or years could have been strategically used to reverse or to better manage the onset of the condition. But those years are instead wasted. Talk about unnecessary suffering. Problem number 3, too often practitioners do not understand the limitations of the labs. I always say we need to exploit labs. We can't let the labs alone tell us what's happening, especially certain labs. Modern healthcare's testing of everything from blood sugar to cholesterol to vitamin D to vitamin B12 to hormone testing, so thyroid, sex, and stress hormones, all of that kind of testing is limited. And too often, doctors and practitioners fall into the trap of reductive interpretation or just plain being ill-informed about the limitations of these labs and how to work around those limitations. Problem number 4. Too often, practitioners do not look at labs dynamically or interrelationally. Many doctors and practitioners just read labs line by line without connecting the dots. I've witnessed this with both conventional and alternative doctors and practitioners. I've witnessed this with my own personal experiences, with my clients, with those providers who they've worked with. And many doctors and practitioners are not equipped to do otherwise. They're not equipped to go beyond just reading what is there line by line. A lot of conventional doctors often don't run all important preliminary tests. We've gone over this already with my previous points. And for those tests that they do run, they don't usually read between the lines. Sadly, many alternative doctors and providers don't run enough tests either. And when they do, they often also don't read between the lines or apply like that kind of critical thinking that's really necessary to pop out and look at like, what's deeply going on. You may experience some providers who actually do this, and that's wonderful, but that's not the norm. That's what we're talking about here. It's not the norm. Problem number 5, genetic testing and supplement selection should not come first. Foundational lab testing and foundational assessments or questionnaires about things like lifestyle, diet, and environmental stressors to rule out baseline issues and stressors are necessary before selecting most supplements and before considering anything fancy like genetics. So think of the MTHFR variants or these other kinds of dirty genes that we hear a lot about, right? I like to call those things fancy, right? Doesn't mean that they don't have their place and they're valuable. We're talking about where this is introduced, okay? So we don't want to be doing this too soon. This goes back to my first point. Even though preliminary lab testing is generally inadequate, that doesn't mean we should test everything under the sun or put the cart before the horse. Testing for genetics without first looking at biochemistry and epigenetics, epigenomics, it's putting the cart before the horse. A good doctor or practitioner can often hear the symptoms, look at the biochemistry, the blood markers, the urinary markers, and ascertain if certain dirty genes are in fact active before they ever directly look at the genetics. So instead, I can't tell you how many times I've seen clients who are homozygous. So they're plus for these dirty genes, right? They're called variants. So the notorious, right, MTHFR genetic variant, right? And then instead though, even though I know that they're homozygous, okay? They know that they're homozygous. I'm telling you this, I have seen several scenarios play out here. Okay, so one example is that the biochemistry and the symptoms clearly indicated that the gene was not active. So they've got the gene, they're even plus for it, and yet the gene is not active, okay? That happens a lot, actually. Another thing that happens is that doctors, mainstream and alternative, treat the gene. That's like a phrase, a saying. They treat the gene without adequately testing or in spite of nothing being wrong in the labs and the symptoms. And they might be looking at the functional reference ranges or the standard reference ranges. So another scenario that I've seen play out is where doctors and practitioners missed the mark and they attributed the symptoms to something like MTHFR without assessing for other conditions and other root causes. Because, and I'm going to get to this in a moment, genes are not root causes. Bookmark that. Hold on. So another scenario is where doctors and practitioners accurately diagnose the likes of an active and dysregulated MTHFR, but they didn't then examine the root cause. So hear me loud and clear when I say this. Active dirty genes are never root causes. They do not become active in a bubble. There is always something that triggers those genes. Okay, so it doesn't mean that there's no value in genetics. It's just saying we need to be looking at this in a greater context. We can't only be, the right off the bat, it's the genes. We got to look at the genes. No, we have to consider this in the context of other things, the biochemistry, right? The symptoms, like, well, what's turning on the gene if it is in fact turned on, right? So you can see there's multiple scenarios wherein informed foundational lab testing, foundational assessments can help rule out baseline issues and stressors and properly figure out what's going on before getting fancy. So what does all this mean? I always say I have a huge amount of respect for doctors and practitioners, but everyone is human with edges. It's also more common than I'd like for doctors or practitioners to attend a 2-day conference and then promote the conference topic as one of their specialties. I've seen this a lot. A lot of people don't realize that doctors and practitioners can be tremendously valuable guides and allies in health, but the state of modern healthcare is still evolving. It's always evolving. This reality check could feel confrontational. You could lapse into anxiety and feel your inner child get triggered because you feel helpless and alone. And that's an understandable response when you've gotten used to slipping through the cracks of modern healthcare. Except you're not alone. Empowerment is yours. You just have to commit to growing your edge, and you have to give yourself space to sit with questions. I'm committed to helping you along in your journey, providing insights from my own professional and clinical work, as well as my own personal experiences with complex health issues. I, too, know what it's like to have slipped through the cracks of modern healthcare, both conventional and alternative, and you are not alone. For more problems with lab testing in both conventional and alternative healthcare, check out my video, Myths of Vitamin D, Testing and Supplements.